Hey everyone, welcome to episode 11 of Trucksafe Live, the monthly show where we and our guests tackle the hot button issues impacting highway transportation. I'm Brandon, this is Jared.
Hey everybody.
We are with Trucksafe and Childress Law, both of which are dedicated to helping motor carriers develop and maintain cutting-edge safety programs. I got a great show today talking about driver health and fitness issues, another hot button issue that comes up with a lot of our clients. So we wanted to spend some time talking about that. We all can get out there, the better. So maybe we start there, Matt, with kind of even just starting from the very basic level of kind of DOT physicals. Can you give us a sense of, basically what types of things for any prospective drivers out there who are new to the industry looking to get into it? What do they need to know about DOT physical exam requirements and that type of stuff?
Yeah, so there's basically two types of requirements that that the FMCSA wants you to be compliant with in order to get your medical card. Things that are 100% a standard that the FMCSA says the medical examiner, we have no leeway. They have to meet this certain standard. The easy ones to kind of pinpoint are like a vision standard. Your vision has to be X, Y, and Z. Now there's this alternative vision standard, and again, I've made videos of, we can go on and on about that, but you have to meet a certain vision standard. If you have diabetes, you have to meet a certain standard. If you have hearing loss, or your hearing has to be a certain standard, and on and on and on. And there's a lot of things that the FMCSA kind of expects the medical examiner. They'll give us guidance, but they'll expect the medical examiner to be able to kind of use their best judgment. The goal, my job is not to figure out if a driver that comes in is healthy or needs medical treatment or needs a medication. My job as the medical examiner is to figure out if it is safe for you to be on the road and nothing else. So yes, there are certain standards, and again, I've done so many videos on all of the individual standards, so I wouldn't want to like go over every single one. But if it is safe for you to be on the road, if you're not going to have a stroke, God forbid, or pass out because you're too tired, or these kind of things that the FMCSA is trying to prevent accidents, then you're probably likely, or you should pass the DOT physical. So I think that drivers have a lot more they're a lot more nervous than they really should be when they come into my office more often than not. And again, I'm not going to speak for anybody individually. I don't want to guarantee that somebody's going to pass their medical exam, but more often than not, I'm passing people unless they really have something that should be addressed before.
And ultimately, what you're working towards when you're doing the medical exams is a medical card, right? Can you
Right.
kind of go through that? And then, I understand that there's different, you can issue them for different lengths of time based on what you're seeing in the exam. How does
Yeah.
that work generally?
Yeah, so that's actually a good point, and something that, again, there's a lot of confusion with when drivers come in. So there's 3-month cards, there's 1-year cards, and there's 2-year cards. 2 years is the maximum you can be certified for. You have to be pretty healthy to get a 2-year card. For instance, if you have high blood pressure, even if it's managed really, really well, you're taking blood pressure medication, and I read your blood pressure, and it's a really good range. Blood pressure, being diagnosed as having high blood pressure, cuts you down automatically to a 1-year card. So there's a lot of individual things like that, but 3-month cards are basically for, there's a problem that needs to get resolved. I'm going to give you 3 months to resolve it and then come back. 1 year is for things that need to be checked more frequently. Blood pressure is the number one thing that I issue a 1-year card for. And then, I'd say 50% of the time people come in, they're getting a 2-year card pretty easily. If you check no on all of your intake paperwork and I really can't find anything egregious during the exam, you're getting a 2-year card.
I want to ask Matt a question about sleep apnea and kind of what you're seeing
Mhm.
there. We've had the FMCSA make pushes in the past to try to get a sleep apnea regulation put in place, and it failed for a number of reasons. The hangup could have been, the actual parameters of that, what triggers the sleep apnea testing, or who bears the cost of that. In your opinion, what was the biggest reason for the failure of that sleep apnea regulation, and what can we do in the future with that?
Right. Well, so it's important to note first that there's guidance from the FMCSA on kind of what they think, or there's been studies that they say use as guidance, but there is nothing that the FMCSA says you have to do this or you have to do X, Y, and Z when a driver comes in and is on a sleep machine, is on a CPAP or BiPAP or whatever, or fit under these other criteria that would stimulate you to want to get a sleep study, for instance, neck size or their BMI or something like that. So I can't tell you really why they don't give us standards. I would prefer them to just give us straight up standards. If their BMI is this and their neck is this, they have to have a sleep study done. I usually won't do them. I won't trigger a sleep study in these situations unless I see something else, like unless I am seeing or my feel is that maybe they are having an issue here and is going to be dangerous. Again, I always go back to, is it going to be dangerous for you to be on the road? Is it unsafe for you to be on the road? I'm not going to just say, well, your neck is too big, so I'm going to send you for a sleep study. But there are a lot of, and I've talked to other CMEs that will do it all every single time. Every single time that a driver's neck is too big or their BMI is whatever, they will send them for a sleep study. So it's this inconsistency with the way that the exams are done. And I'm not saying that one is wrong and one is right. Certainly, somebody can 100%, meaning a medical examiner can 100% trigger an exam for any reason that they want if they feel that that's what they need to be comfortable giving this person a medical card. So I'm not saying that's wrong, but I would rather have that from the FMCSA. The FMCSA is taking regulations or taking the information away more from the certified medical examiner than they are giving it. I mean, they did away with their most recent medical examiner handbook. They have one that they're drafting right now that isn't, as they tell me, it isn't ready yet and I shouldn't be using, but we have no piece of documentation at this very moment that says these are the standards, these are the waiting periods, these are how long that you can certify somebody for. I would prefer that, to be honest. So I can't really give you an answer to why that doesn't happen. I think it should happen. I think the FMCSA should be more clear with specifically what they want on some of these big topics, like sleep apnea being one of the biggest ones that I see.
Yeah, it's, I ask that question just because I've been curious. I've always wanted to talk to a medical examiner about the sleep apnea issue specifically, but I recently looked at a fleet and did a risk assessment on a fleet that had a really inordinate number of drivers with very high BMIs. I'm talking one driver had a BMI of 68, and how that driver could be medically certified was pretty surprising to me. I mean, do you ever see drivers that have BMIs that are just astonishing, that don't have those chronic issues that would warrant a lesser medical card?
I don't know if I've ever seen a 68. Just to be honest with you, I don't know if I've ever seen that. But yeah, a 68 would be it would be tough for you to get a medical card from me. I mean, there's a degree of what's reasonable and that's you would, if somebody came in, they had a 68 BMI and didn't have high blood pressure, blood sugar control regulation issues, prediabetes, whatever it is, sleep apnea. I mean, they 100% would have sleep apnea. I wouldn't know.
It's a miracle.
That's you would need to get a blood sample from that driver so you could test that blood because he's a superhero.
That's exactly right. I mean, I've seen weird things. I've seen drivers that visually look at them and weigh them and whatever that look like, oh, this person's going to be super, super unhealthy. And they're not on any medications. I read their blood pressure and it's like they were a 18-year-old girl. I mean, it's crazy stuff. Basically, it's, just to close out the sleep apnea, I'll just give you what I do personally, which I think is pretty appropriate, is if I think that somebody is at risk for having sleep apnea, again, not just based on what their size of their neck or their BMI is, but I'm seeing signs or they're checking their paperwork that they are sleepy a lot of the times or need a nap during the day or whatever. If I'm just getting that sense, I'll send them for a sleep study test, but I really won't beyond that. But what I will do is if somebody has sleep apnea and is using a machine currently, I will ask for a month of data that shows that they're being compliant with using their machine, because I do feel like that is very important for the safety. If you've been diagnosed and you are under medical treatment, you should be following that medical treatment, and I should be able to get that information to make it very, very clear that it is safe for you to drive. So that's kind of how I play the sleep apnea as far as getting somebody a medical card or not.
I did want to ask you kind of on that point. It seems like I've had this situation come up a few times for for carriers who come to me, obviously carriers have an obligation to make sure that their drivers have valid and up-to-date medical cards, and they kind of have to track the expirations because you don't want a driver out on the road who has an expired medical card. That can lead to issues with their CDLs being downgraded, et cetera. Seems like I've seen issues where a driver receives a medical card for however long it's going to be valid for, but then the medical examiner will issue like a recommendation to them to go get a sleep study. And so the carriers come to me and say, well, what do we do with that? Is that something they have to do to remain qualified or not? And so I know that it always seems a little odd to me for that to happen because, at least in my understanding of the regulations, is you either get the medical card or you don't from the medical examiner. And then, like you said, Matt, you kind of leave it up to their treating physician to kind of deal with the management of the issues. How does that work? At least, how do you do it when you identify folks who you think do need a sleep study? Do you hold off on issuing the med card until the sleep study's done? I would assume that would how it would work normally.
Okay, so a couple different things here. One is number one is I hear some crazy stuff about exams being, because I'll see drivers a lot of times and they've had exams done by other people. And again, I'm not saying anybody else is doing anything wrong, or you leave it up to the provider's best judgment. But I hear all kinds of weird stuff about they gave me the card, but they said do this, and so they're so again, I go back to my job is to make to see if you're safe to drive, and I want you to be healthy. I'm a humanitarian. I care about people, but my job is not to figure out if you need to be treated for something medically. It's to see to make sure that you can drive. So once I hand you that card and you walk out my door and my people put you into the computer, you're medically cleared to drive. You don't need to do anything else. You have that piece of paper, you're good to go.
Yeah, that always seemed weird to me when I would get those situations because it puts the carriers in a bad spot because the driver under the regulations is qualified because they've got a med card, but now you've got something out there that says this driver should be doing something else. And so now as a carrier looking at it, I'm worried about that driver getting involved in an accident. And now we knew that there was a doctor out there who said they need to go get a sleep study, even though they got a valid medical card. So that always struck me as a little odd.
I've never done that personally. I've heard of kind of weird situations like that. I don't think that's the standard that
Yeah.
should be applied. As far as issuing cards and not, if I feel like somebody has a pretty good handle on, like for sleep apnea, I'm not going to not certify them day of. That's where those 3 month clearance certifications can come in, and then that gives them time to go out and get the um, data that they need. I do that a lot for a lot of different reasons, to be honest. If I thought somebody needed a sleep study, I would give them a 3 month card, unless again I thought there was another reason for them not to be on the road right then and there.